Alrighty. I think that's our cue to get started here. Thank you all for joining us. We're having a panel on med student involvement in voter registration, specifically our coordination with Vot-ER, which, as you probably are aware, is this fancy new system that we have to be able to register people through text messaging, QR codes, etc. In our healthcare settings. So thank you so much for being here. We wanted to give you guys a sense of who I am and then help get our panelists going as well. I'm Halia. I am a physician, resident physician at the University of New Mexico and the former chair of Met Out the Vote. And I am really excited to introduce some of my colleagues who have been working on voter registration throughout the last year, and some that have just been joining us within the past few months and have been making a lot of really exciting progress. So I will have my former co-chair, John, go ahead and start us off, and then we'll, get started.
Thank you very much, Halia. I'm John Kushner, a fourth-year student at Harvard Medical School. I was the past co-chair for the Met Out the Vote campaign. I'm currently a co-chair with Jess, who will introduce herself imminently, and Leka Chilikamari. Jess, perhaps I could pass it off to you.
Hey, my name is Jess Lechtenberg. I'm also a fourth-year medical student at UNC. And like John said, I am one of the co-chairs of Met Out the Vote this year. Really excited to see you all here. Aloha, maybe I can pass it off to you.
Hey everyone, my name is Aloha Akovi. I am a fourth-year med student at Brown, and I am co-chair for the Student National Medical Association's Health Policy and Legislative Affairs Committee, and I'm happy to be here. Pass it on to Masa.
Hey everyone, I'm Masa. I'm a third-year medical student at Duke. I am one of the co-captains of our Vot-ER cohort here. And as Halia alluded to earlier, I'm one of the newer recruits, for lack of better words, in this kind of activist space. And I'm also really excited to be here.
Perfect, yeah. So as you can tell, some new, some older, kind of working on this work, and just wanted to give you guys a sense of kind of what brought each of us to this work. I think it's something that people come at from a lot of different angles. For me personally, it was something that I realized that a lot of my patients in Colorado, where I did medical school, didn't really have access to the ability to register. And then especially in COVID times, or whatever we want to call this era that we find ourselves in, we noticed that there's even fewer people registering, even though Colorado is an all mail-in ballot state. And so just such an easy thing to do, but such an easy thing also to miss out on if you don't get registered to vote. So had the opportunity to work with my faculty and allow, even during COVID, they were able to let us do the kind of earlier version of Vot-ER, which is the kiosks and posters with QR codes in our emergency room in Colorado. And so that was kind of how I got involved in this work. And I would love to hear, especially from Masa, about just your involvement with the campaign at Duke.
Yeah, so I've actually been at Duke probably for around 10 years. I was here as an undergraduate too. And so being able to kind of compare, I guess, people's attitude towards advocacy has been interesting in the healthcare space and then the larger university space. I guess in terms of what drew me to it, it seemed kind of like instinctive. I don't know if there wasn't some compelling moment. It's just, it kind of came up. Like I saw, it literally was on someone's Instagram story, and I clicked on the Vot-ER website and I went through. And I was like, this is so duh. Of course, this makes sense. What else would you, why not register folks to vote if they're waiting, in the emergency room, or if literally they're just inpatient to finish a antibiotics course. so I kind of saw it and I was like, this is such a obvious, important thing. Like I kind of felt obligated to kind of pursue next steps. And that's a sentiment I think so many people have shared. I think across the board, anyone at Duke who's been in contact regarding Vot-ER has said something along the lines of, you know, I might not have bandwidth right now, but this is so important and necessary.
Can you tell
So
us
I
a little
think,
bit more about the competition itself, the
yes,
UNC Duke competition that we had kind of early in the preseason, and how you guys did with that?
yes, the fabled Duke UNC rivalry comes up again in a non-basketball format. So I think, actually, I think it was really motivating for some of us, including myself. I'll admit that. I think what was exciting about it is I think it forced us at least to like not just get the ball rolling, but like really run with it. I think as medical students, sometimes we're really attuned to like and used to having everything planned and having all the approvals in place. And I think having this competition not only helped us kind of bounce ideas off each other, but also, you know, in a motivating way, at least for me, made me realize not everything needs to be specifically and perfectly coordinated. So I think for us, at least, it was really informative in strategies that we were good at, and then also things that we needed improvement on.
Awesome.
So,
and
yeah.
in terms of background on that, just wanted to back up a little bit. So what Vot-ER has been doing in the past few weeks has been allowing med students at both Duke and UNC to register voters and kind of compete to see how many voters each of them can register. And so Jess is on the UNC side of things. I thought I'd let her take over.
Yeah, so I was super lucky in that I approached the faculty at UNC and found out that there were already actually a number of students working on getting voter registration institutionalized at UNC, specifically from our SNMA. So I already had a group of really excited students who at least would help get the word out, and support from the administration as well. So I was able to recruit a captain who could kind of lead the effort. And we really just let everyone know and tried to let everyone know the easiest ways that they could do it. I do think that because we got out to such a strong lead in the competition, that maybe there was, it was not quite as motivating for UNC, at least for me. I also was not in the clinical setting at the time, so unable to take advantage of that location. But we got a lot of people registered and actually incorporated it into orientation for our first year medical students as well. So they have a day of service and they went out and helped. There were at least 3 groups that went out and helped register people to vote. And also were able to register themselves because many of them were coming from out of state. So that was a really exciting win for us, I think.
Awesome. And in terms of getting all of that work started, I wanted to get Aloha's thoughts on just like how to approach your institution about institutionalizing this at your school, and you know what barriers, if any, you might have faced.
Yeah, so I would always say the first thing to do when trying to approach your institution for something like this is to find a team of students, a couple of people that are just as passionate about it and are also going to be willing to help coordinate with you before you bring it to your institution, and having a plan to present to your institution. I think that if there is a faculty member or a dean that you feel comfortable speaking with, such as your Dean of Student Affairs, who typically would be readily available and pretty much the best person to talk to about something like this, that would be the first person to reach out to just explain what it is, what your goals are, who your team is, what you are willing to accomplish, and how it will benefit patients. And I think often for something like this that for some people might seem a little bit more on the political side, it's hard to make the argument for the benefit of patients, but because voter registration is a nonpartisan activity, you just want people to make sure that their voices are heard by exercising their right to vote, bringing that sort of frame to your administration, I think is the best place to start, but also making sure that you have people who are also willing to help out with it, and it's not just you.
And John, was wondering, kind of, since we've been working together on this a little while now, why is voter registration something that you felt like med student orgs should take on in addition to all the other things that we try to accomplish in our very short amount of time that we have in med school?
For sure. So I think how I have begun to kind of spin the picture together is with a growing appreciation of the social determinants of health and the proximal impacts that that has on the health and wellness of many of our patients. Interfacing that with, instead of a paternalistic model of we should, as physicians in training, construct society, moving more towards a co-production model where we want to empower the voices of those most affected by these social policies in achieving the solutions that they think will benefit the circumstances in their lives. So I think voter registration has a natural, really professional responsibility argument for the healthcare space of why to get involved in this work.
Awesome. And I can see all of you, so I'll just take hands really quickly. Who has had an experience of someone being a little bit skeptical of the nonpartisan focus that Aloha was kind of alluding to? So almost everybody. Jess, I think I'll have you, as someone who goes to a public institution, you kind of have a, I think some insight on how we can approach these situations where people might be skeptical.
Yeah, so like I said, at UNC, we were really lucky that the medical school was on board very quickly. Partly through SNMA making demands for voter registration after at a rally for George Floyd. And also it was couched in our wellness department. Actually, we had the wellness coach really come in and supported it pretty immediately. So the medical school itself was actually pretty straightforward, luckily. But when we tried reaching out to the hospital system through our dean, who helped us make those connections, at first we received a lot of excitement from both the hospital president and the CEO, and had meetings directly with them prior to my involvement with the UNC setup. But then more recently, after talking about how exactly to implement it, they had a discussion with their legal department, and there is a stipulation that says basically that state employees cannot use state time for political activity. So we said, okay, that's fine. Voter registration is not political. And the fear is that if any one person accidentally or intentionally says something that could be misconstrued as political, then if that gets back to our General Assembly, which you guys may know in North Carolina is quite conservative and probably looking not to expand the vote, frankly, then UNC hospital system could actually lose funding because of that. So we are still in works with the hospital to see what kinds of ways we can continue with voter registration. They're totally fine with medical students hosting voter registration drives. But they've explicitly said that staff and faculty are not allowed to talk about voter registration with their patients, and that they're not going to institutionalize it in the ways that we wanted to. So during their off time, staff and faculty are more than welcome to do it, but we're kind of working through the kinks and working with the legal department and figuring out how best to go about it, because I know there are a lot of faculty members who have already ordered their Vot-ER kits, regardless of our efforts and probably are continuing to register voters despite the institutional question mark.
Thanks for that background. And Miles, so do you want to talk a little bit about what things have looked like at Duke in terms of getting your efforts off the ground and who you needed to talk to?
Yeah, so we similarly approached our dean of the med school and actually also the chancellor of the Duke Health System. We did not have we didn't really have a very significant response from them. You know, I would say there was no rejection. I think there was this sentiment of, I think Duke is planning something and we don't want to duplicate efforts. Left it kind of vague. Though, like being here for for my undergraduate experience as well, I know that Duke is generally supportive of, I guess, like at least undergraduate voter registration efforts that are taken by certain organizations. I think what makes the time and context now really important is that what someone was telling me, you know, hospitals and healthcare systems or clinics are actually one of the few touch points that a lot of people are frequenting at this time. And so, not that it's our duty or obligation, you know, legally, but I think it does, I don't know, I think it does change the situation a little bit in terms of giving us permission, you know, or institutionalizing voter registration. So I guess at Duke, our experience hasn't been as fruitful from an administrative approval standpoint, though we have had so many attendings and residents reach out, not even to me, but to Vot-ER. And then people at Vot-ER will forward those emails to me and say like, hey, this is your team captain. And I think that has been so overwhelming in a positive way, obviously. I think for medical students, at least, to see people that you look up to or to see people that you're learning from be invested in this as well was really inspiring for me, at least. And I know some of the people that were organizing too were really surprised. They're like, oh wow, like I didn't realize like all of these people were interested. So I guess that our experience at Duke has been not a polar opposite, but a little bit different. And I think it's something that a lot of folks are going to come across as they try and get this approved or supported at our institution. I think one piece of advice I would have, if I could kind of go back and do it, is instead of asking for like approval, just asking for support. And I think that would have been maybe a little bit more fruitful. You know, just reaching out to a handful of faculty and being like, we would just love your support on this. So yeah, I guess live and learn.
Could not agree more. I think that a lot of times that faculty support is there when you, you know, have at least one faculty member or resident who will go to bat for you. And that's been, you know, a huge relief to see. I'm not even, you know, at the same institution for residency as I was for medical school, and the medical students there are still being really wonderful about, you know, trying to expand the work, trying to talk to different departments, talk to different faculty, see if they can get our medical student council on board, and you know, just kind of figure out like who can support the work. So definitely echo that. I was wondering, Aloha, if you have any kind of ideas or context of how to approach a new user of a kit that you're trying to get to kind of be invested in doing this.
I think the easiest way to use the kit, especially for folks who might not feel as either an extrovert or outgoing or really ready to just jump in and like mention it to patients, is have it be as visible as possible. Have it such that, like, for example, you know, on my badge or on my white coat, I have pins that are really visible and people ask me about it all the time. So have it be as visible as possible such that it's more likely for someone to say, oh, what's that? And then that starts the conversation without you having to, you know, find the best time to stop someone in an encounter to bring it up. So I think that that's sort of like a universal way to that everyone can sort of adopt. If you're definitely someone who's okay with just jumping right in there, then make it an easy conversation and mention, while you're, especially for preventative visits, while you're talking about your, vaccines or your the things that you do annually at visits, mention, oh, by the way, also, do you know that, this year is an election year, and XYZ deadlines for registering to vote, have you already voted, are also good ways to bring it up, such that you're not mentioning anything that's partisan, and you're also getting a feel for whether the patient is interested in hearing what you have to say or not. But I think generally leaving it open for someone to start the conversation by mentioning something that they notice is usually a good way to go about it.
Awesome, thank you. And I was wondering, before we get to Q&A, because it looks like we have at least one question there and we're nearing our halfway point, if anyone else has any insights that they'd like to share on workflow and how to kind of work it into your patient encounters.
Masa, you go ahead.
So it's not necessarily like a specifically patient encounters, but one thing that we did last week as kind of the Duke Vot-ER cohort was a lot of us were volunteering already at a COVID-19 like drive-through testing site. And for like the first 2 hours, people were really just like waiting, I think, while workflow was being sorted out. And so we actually got almost 100 people registered or connected to resources through the Vot-ER site. And what we really were doing there was capitalizing on wait times. And what was like really brilliant about it too was like for so many people, like they didn't even have to open their window all the way. Like they just scanned a QR code. And so I think, just kind of in terms of advice on how to encounter patients, something I've seen, even like in Alistair's email or in a lot of people's email signatures saying like, I want to make sure that you can safely vote in November, especially given everything that's going on. I think what's challenging about that, the mail-in ballots now, is kind of the conversation that you might have with someone about, well, how do I know my vote's going to be counted? Or, I'm really nervous about that. Something a lot of people in line that day were saying, we're like, no, I'm going to go in person. Like I don't trust, this. And, I, at that point, don't really offer a rebuttal. I just say, I'm just happy that and that's the thing too, to remember, like, we're not registering folks to vote. Folks are registering themselves to vote here. Like I'm not getting any information from people. I'm literally just connecting you with a resource that's going to make it super easy for you to register if you want to. Like, that's what I would say. I was saying like, here's the QR code, like scan it, check it out. Check your status, check if you're registered. But I think this like notion that we're doing something political can really be challenged by saying like, I'm not registering anyone, I'm not taking any forms. Like, so that's kind of just what I wanted to share in terms of our experience here.
Yeah, and I think that segues really nicely into this question that we have from Lucy Brown, where she's saying there's been a big push for healthcare professionals to stay in their lane by politicians trying to silence people, which I feel like reflects an antiquated sentiment that doctors should avoid politics. And how do we combat this? I think all of us have alluded to things a little bit. I know, John, in particular, you've been writing about this recently. If you want to
put me in, Coach. Yeah, so I think there are a couple angles to take on this, but I think one compelling approach is that we aren't really instructed in the difference between political engagement and partisan engagement. And so, although this is political work, which is just generally in the brand of participation, trying to get people to engage with the systems of governance that really hold power over their lives, is different than partisan engagement, where you're really promoting an ideology, an individual, or an issue. The unfortunate thing about pro-participation measures is we would be remiss if we don't talk about voter suppression in the political history of the United States. And so these pro-participation measures are undoing decades of voter suppression. And so it may have the appearance of a partisan nature, but that says much more about the history that we're coming out of than the intentions of any current effort. And so the introspection is not on the part of the individuals who are being pro-democratic, and that's a small d, system of governance democratic, than it does about the people who have been historically doing the suppression. So the question really is, why are so many individuals who are being enfranchised maybe leaning towards an issue or leaning towards a party that says much more about the history than any current circumstance? So I think that would be one initial rebuttal, the difference between political and partisan engagement, and that political engagement is extremely resonant with the other services that healthcare provides, often linking with social services and other empowerment practices that we are very comfortable understanding as a dimension of healthcare, linking people, say, with food stamps or something like this. And then the other is this idea of the social determinants of health, which is like broad, and I can't, give a great expose on all the impacts that are socially mediated on people's health and wellness. And nor should we be the purveyors of those solutions, because we are necessarily uninformed, or at least I am by my privilege.
Yeah.
And so we should empower the voices
And
of the individuals.
Some others a chance to kind of talk
Sorry,
about,
you guys.
Yeah, no problem. About kind of why they feel that this is, the work of healthcare professionals as something that we should be engaged in. I saw some nodding. Do I have any takers? Maybe. All right, I'll take a quick stab at it as well. I think another thing that's really important to mention is the fact that the same law that gave departments of motor vehicles the opportunity to register voters, we have that opportunity as hospitals, and they are actually mentioned in that law as well. It's just not something that's been mandated by states, as it has been mandated for you to be able to register to vote as you're getting your driver's license. So there's nothing to say that we can't, and there is everything to say, in federal law, that we can be part of this work. And I think it was Masa who had mentioned earlier, we have a lot of people who are not really leaving their house for anything else. And so if they're seeking healthcare and we have this touch point with them, I think many of us feel that this is, really actively our responsibility to go after this opportunity. Jess, did you have further thoughts?
Yeah, I mostly want to echo everything that both of you have just said. I really feel like as physicians, it is a huge part of our job to help give voice to people who don't necessarily have voice, and to help people live their life in a safe way. And especially in the context of a pandemic, though I would say that this is true at all times, I think it's important for us to help people navigate and think about, how does voting affect my health? Does voting affect my health? And, it's the same reason why I took a year off to do my MPH. There's so much outside of the clinical setting that we can't control, but it would be great if we help empower our patients, which is really, that's what all motivational interviewing is, and what all of healthcare is all we're saying is, hey, these are your options. Let me empower you to take control of your own health and take control of your own life. And again, especially in the context of a pandemic, making sure people have a safe way to vote is so important, especially given how much voter registration has decreased this year. Like you said, having that healthcare touch point is so important also.
Absolutely. Has anyone gotten a question from a patient that they had trouble answering, or really had to do some, kind of searching as far as how they would address that?
I had just a logistical question. A lot of people were like, well, listen, if I order this absentee ballot, but then I want to go vote that day, can I do that? And so by some like chance, one of the individuals getting tested that day was a member of the Durham Board of Elections. And she was like, yes, in Durham, you can order an absentee ballot. And if you don't use it, you can go vote at your specific polling location that day. So I would say, I mean, this isn't maybe the gist of the question, but I think there are going to be a lot of logistical things that can come up. And I think being prepared, or like team captains, kind of looking at your local Board of Elections policies and things like that, or just printing that out or having that PDF on your phone would be super helpful. So that's just kind of like one angle, I guess, on that question. I just won't forget when she said that. And I was like, I don't know.
Yeah. And definitely an optional thing, but something that I found in my former state was that you could take like a voter registration training for people who are like, you know, canvassing broadly, registering people widely. And so that kind of can give you more of an insight as far as like what your local laws and regulations are. The other thing is like, if you ever encounter a question like that, Vot-ER is trying to partner with local voter reg orgs across the country. So please feel free to like, you know, ask questions of Vot-ER, because we have, you know, people and organizations that are explicitly trying to help with that. We have another question from Mina that also relates to logistics. And she was wondering, I apologize, I'm being terrible about pronouns today, so I should be saying they because I haven't asked anyone what their pronouns are. The question is that more of a logistical question on registering. Have you had any issues registering voters that don't have a smartphone or internet access? Which is a question I've gotten too. Hasn't registered anyone yet, but seems like Vot-ER system really works by providing patients with links and QR codes, which they then have to use to register themselves. If this is the case, how do you have success registering voters when not all patients have smartphones or internet access? Do we have laptops or iPads on site? Does anyone feel like they can take that on?
I can at least start our discussion.
Perfect.
This is definitely a disparity that exists kind of in the current state of the field. So you're you know, right in naming it. I think the thing that many have put in place in order to subvert this is there is a national voter registration form, or there are hard copy forms for each state. These can be filled out in person and then mailed to the state election office or the state secretary of state. So I know for individuals, if they don't have some form of technology that could facilitate the text code or the QR code, you can go to pen and paper with the national form.
Absolutely. And I think another aspect of that that Mina was bringing up is about whether there are technology kind of assists available. We historically, as like Vot-ER, did have this available, but due to concerns about fomites, the laptops that were being put in ERs have really had to scale back. So you might find these in some locations, not all. And then another portion of that I think is, you know, perfectly segues into what John was talking about, is that oftentimes we don't always respect the fact that people speak a million different languages in this country and might not be able to register via our online system in English or Spanish. And so if you work in a context like I do, where my patients are literally from all over the world, having those paper forms available for people who need them in, you know, Vietnamese, Swahili, whatever it is, it's actually in like 25 languages if you go find that form. So hope that helps to answer. And if anyone continues to have questions that they kind of want a follow-up on, we're happy to, you know, keep answering.
I just want to jump in and say, I think it's so amazing that I love that Masa had that great story of describing that she got a question that she didn't know the answer to. I think as medical students, we're so well trained to say, I don't know, but I can go find out for you. And I don't want that to make anyone afraid to start. Because at the end of the day, you have to start somewhere. And if you don't have all the answers, that's okay. you still have something. And Met Out the Vote and Vot-ER have a tons of resources. If you're interested in getting any of them, let any of us know, and we're happy to help connect you and talk to you individually, one-on-one. But at the end of the day, like I was saying, we know how to say, I don't know, but I'll find out, because we're asked questions 1,000 times a day that we don't know the answer to. So just want.
Anything from this work that has been particularly rewarding for you, a patient that you have registered or a colleague that has asked you a question about voter registration as a result of knowing that you're someone who is working with Vot-ER?
I guess something that also happened on the same day when we were doing this voter registration. So I'm sure Duke's not alone in this, but like the university and then the town that a university surrounds, there's a lot, I guess Duke at least has a lot of history with Durham. And I imagine that a lot of other universities and colleges have this. And I think there was a someone who was like, accessing the codes, and they were just kind of like going through it. And they were like, honestly, this is probably one of the first times I've ever seen Duke try and do some good for the Durham community. And I think, without knowing the context, it just seems very, maybe not like a very serious comment, but being here for so long, and especially in healthcare, people are always talking about like, what kind of screenings can we do? And then people will say like, oh, but like a lot of people in the Durham community don't have good experiences with the healthcare system or with Duke. So like there's this divide that's kind of created there before patients even step foot in the hospital. And so to hear that kind of made me feel like this was so like such limited effort. Like this was so like little from me, but it meant so much, and it showed kind of that willingness to engage in your community. And that does kind of carry. The other thing that was really cool was someone asked me if they could, it wasn't my idea. They asked if I could airdrop them the QR code. And I was like, yes, like I can totally airdrop it to you. And they're like, yeah, I just want to send it to some people. This was so easy. So those were two kind of inspiring things or exciting things that happened. And it's just an investment of time, but you'd be surprised at how rewarding it can be.
Absolutely. I think you bring up some really amazing points about the fact that a lot of hospital systems are trying to provide public benefit to their communities. So if anyone on this webinar has a hospital system that hasn't yet signed on to be a partner for Civic Health Month and a partner of Vot-ER generally, that's been a really helpful framing for people who are trying to pitch things to, CEOs, to other people in charge, because all nonprofit orgs like really do have to show that they're providing public benefit, and this is one of the many ways that they can do that. And we've gotten a lot of support from hospital systems and associations that you might not expect by kind of framing it in that way. Trying to be good with silence. It's always a challenge to not fill every single moment. I think, yeah, go ahead.
I had one more kind of thing. So it made me kind of think, I think not always, but I've seen sometimes like certain social movements, like groups within will get competitive, like, oh, like we're doing a voter registration. Or like, oh no, we're doing it. And I can foresee as like undergrads come back, obviously, and rightfully people will want to take part in these things. And so I think proactively reaching out to groups and administrators for like who historically has done this, like who at our university has spearheaded these things. Let's get partnered with them early so we can share strategies and not duplicate efforts. So it's like something I did today. I just Googled Duke voter registration and looked up our Pub Hall school actually does a pretty regular voter registration or voting effort. And so I reached out to them and was like, this is what we're doing on the healthcare side. Just FYI / would love your support. Would love to support you. So just as like an advice thing, because I definitely have seen, well, at least that's the argument we were given, right? They were like, well, we don't know if we want to support this because there might be like a better, larger effort. And I think the reality is there doesn't need to be one and there shouldn't be one. If we're going to effectively and safely register a lot of folks to vote, I think there should be multiple different ways. But just being organized, I think, is really important. So just as some advice.
Yeah, absolutely. And I think John could talk to us a lot more about that point. I just had a quick plug for talking about Vot-ER during your either intern orientation, as my case might be, or when MS1s are coming back. We recently did this at my former med school, and all they did was just, they had a slide as part of this like welcome slide deck. And that way, all of these people that are, potentially moving within the state or from out of state have the ability to register just as part of their like get situated in this new environment. So Jess, I think you were going to say something, and then John, I'd love to hear more about kind of the integration of the med students with all the other parts of the like Harvard Vote stuff.
Yeah, I was just going to say, I've been so encouraged by, as this movement grows, people have been reaching out to us, actually, sorry, that's my cat. People have been reaching out to us and saying, hey, I heard you're doing voter registration. I've been wanting to do it too. How can I get involved? And we also have great organizations in North Carolina who work on voter registration who are saying, oh, thank you so much for doing this. And also not just that, but saying, hey, we have so many resources that we normally put towards in-person voter registration drives. Like, please, like, tap us in, like, let us help you. So we're really excited to start working with them more, especially now that the hospital system has said no to physicians talking to patients. Really excited to say, hey, like, can we get you in here? Because that is totally fine.
And then John, just wanted to tag you in. Oh, I think he is. There we go. Just to talk about kind of how
Am I lagging?
There's been that integration.
Hello?
You're there. We can hear you.
Okay. So I think Masa really said it best, of like getting to know your local context of who's doing the good work. I think the one thing I additionally want to say is that the Healthy Democracy campaign is what we've been discussing here. So this is an initiative led by Vot-ER and Met Out the Vote to make institution-specific voter registration resources. So I'm sure after this event, we'll provide a link to how to engage with that process. But we only offer really good resources. But as Masa said, there's tons of people in this space. So doing a little bit of groundwork of who is in your local area and how to interface with them. And then again, like once you fill out the form to get involved with this process, it's not like we just talk once. It is a bi-directional flow of info. We are there to support and mentor you through this process. Like others have said on the panel, we work closely with the League of Women Voters. They have a resource called Vote 411, which I encourage people to check out. All of this to say that there's good work going on, and we'll help you to navigate those spaces once you engage.
And just wanted to give a quick shout out also to Aloha and the work that SNMA is doing. They're also a partner with Vot-ER on Civic Health Month and with the campaign at large. And so I think it's important, as we're alluding to, find the specific resources, specific orgs that are super involved at your school. And if you're an SNMA member, if you're an AMSA member, if you're just anybody, you can either reach out through your organization or you can reach out directly to Vot-ER. And I'm sure all of those different people would be happy to help, find the folks at your school that are engaging. Does anyone have anything else they feel like would be really helpful for new users to know as they start, kind of jumping off into this? Okay.
Sorry, I was just going to say, as someone who's like a little bit maybe newer to the like medical school advocacy space, they're like, okay, being organized is so like important. I was going to say it's underrated, but like the true strategy and organization that goes into like a successful movement, I think is not something I knew about, historically, but I didn't like put it together and say like, oh, I should be that organized now too. But reach out to like friends that you have that are doing advocacy and activism on other platforms too, and say like, what are good strategies for getting approval for something, or how do you respond to X? Or like, something I remember asking, I was asking my like faculty kind of mentors, like, who should I reach out to? Because faculty also know other faculty. Like they're like, oh, I know the VP of this, like you should reach out to him. Like he's a great person or she's a great person to know. So trying to strategize early and simultaneously, or rather strategizing simultaneously, I think is really important, that you don't have to have all those connections in first and then order your kits. Something that we were doing, or I was doing, I was like, no, let me find out, like, let me email all these people and then we'll do this. But the beauty of like working on a team is that people can do multiple things at once. So I would just, strongly recommend having a strategizing and planning meeting about things like that, because it's a little bit more complex than I think at least I gave it credit.
And never underestimating the power of who you know, and the fact that you are, by default, we are all kind of in this position of privilege in med school, and the fact that we are training to be physicians. We have a really important voice, and we also have a lot of people who, potentially trained elsewhere, have connections elsewhere, can really kind of help to navigate sticky situations. So. If I don't see any other Q&A questions, so I will just give us a last call if anyone wants to submit anything else through the chat function or the Q&A function. And then just in terms of housekeeping stuff, I'm sure that everyone who attended will probably get an email about taking further steps and any further resources and contact information for our panelists. If you don't get direct contact information, I think all of us would be really happy to speak to you more about this and help get you started in any way that we can. All right. So seeing no more questions, I will give us 7 minutes back of our evenings, because I know we can all use some Zoom time off. And just wanted to say a big thank you to all of our panelists. And yeah, reminder from Ben that this will be posted later. So if you have friends that missed it, or maybe they're at a different school or whatever it is, that will be posted on the Civic Health Month website. So thank you. Take care, y'all.